compression. Yeah, go. I'm going to do some warming up. So we know about holds. Somebody asked me in one of their Ask the Teacher bit about how much pressure you can use with holds. Who asked me that?
I did. How firm should the hold be?
How firm should a hold be? So if I do, so I can do a very light superficial hold, and we'll ask Callum what effect that has.
Not a lot. I just know you're there.
Okay, what else though? Why don't you just pay attention to that for a bit? What do you notice? See, I can feel his breathing start to change, okay? And also I can feel heat building up where my hands are. So don't underestimate that. But also I can use the idea of the holds to actually introduce a little bit of pressure. And we've used pressure around here on the shoulders. And I might actually use a little bit of pressure downwards on the erectors. How's that? And you've also, I might have done pressure here as well. So what's the difference, Callum?
Just feels more stretch when you put a bit of pressure.
More stretching, more pressure, so it has a different effect. Can you use it? Of course you can. Okay, so I'm just going to take... So, do you mind me talking about you, Callum?
No.
What do we notice?
His erector spines is quite pronounced.
Yeah. Quite tight.
So you notice that, right? So
It's quite even on both sides.
yeah, quite even.
And it's got the low doses is very... Low doses? Yeah.
Yes.
It's very accentuate. Does that
What,
make sense?
where are you
Yeah.
talking
Yeah.
about?
That makes sense.
Okay, why do you think you're seeing that? Is it because it's kyphosed elsewhere, or is it because it's actually lordosis?
Sorry, say that again?
The curvatures of the spine.
Yeah.
Kyphosis is an exaggerated outward curve.
This side.
Lordosis is an exaggerated inward curve. So has he got a lordosis, or has he got a kyphosis?
Yeah. Or his kyphosis and his shoulders.
No.
Yeah.
No.
Yeah.
It's fine.
Might be fine, I don't know. I haven't really looked properly. But it's more a question of kind of like really staying open and seeing what's going on. So what we do notice, no, because I see what you see, the actual spine is here, right?
Yeah.
So is there a lordosis or a kyphosis?
No,
No.
you can see
What do we have?
the muscles. Is it the muscles?
Muscles.
Very developed muscles here and here. Thank you, Christian. Okay. So I'm going to just kind of warm up a little bit. So we're going to ask him why. Does he work out?
I cycle a lot.
He cycles a lot. So this is where we start to find out about their story, right? So what posture do you think people who cycle a lot are in? What area of the back do you think is often?
That's right.
Okay, good. Okay, he cycles a lot. Right, so I'm not going to do too much of this kind of warming up. Are you all right with that?
Mm-hmm.
And we're going to go for the more obvious areas. So what can you do here with compression? So I can use one thumb side by side. And I can press into the muscle tissue that's tight. I can move across the fibres if I want to. I'm doing that now. How does that feel, Callum?
Yeah, you can feel it sort of just give way at a certain point.
Okay, yeah, I
Across
can
the arm.
feel it. And can you see that?
Yeah.
As I compress, I'm pressing in and then actually going across the fibres, and you'll just see that jump. Okay, good. I can do that this side. I can do that this side too. But I'm not going to want to do too much of that, because if I work my thumb too much, I'm going to wear my thumb out. Okay? So if I'm not going to do too much of that, I'm going to do the reinforced thumb. So thumb goes down, hand goes on top, and now, how's that coming?
Yeah, it feels a lot more weighty than
Okay.
a lot more pressure.
And it's a lot less effort for me, to be honest. Notice the posture changed as soon as I got into more of a leaning in position. I can go up. Can you see where my thumb had been there? And go up on the tissues there, pressing in, or I can go across. I know you can't see very much of what I'm doing there, but it's going, well, you can see the effect. Okay? I could use my knuckles. We've used knuckles a little bit. I could use my knuckles very specifically. It's the same thing. I'm just going to press. Now this is still with a little bit of movement, isn't it? I haven't found anything, although these muscles are generally tight, I haven't found a knot in there. There's no one area, and I was checking that. The fingers, remember the fingers? I can do that as well. I'm going to come in, press, see if there's anything there. Not really. It's all just generally a little bit tight around there, so I'd want to do a lot more things. Let's see where else we can find something. Oh, look there. Oh, look there. Remember what I said to you?
Yeah.
These are the areas you're going to find a lot of that needs working on. So I can do a lot of kind of petrissage stuff around there, but actually what I want to do now is show you how to work much more specifically. So I don't know whether you can see the movement there when I take my thumb in there. No, you can't really see a twang, can you? But that's where it is, isn't it, Callum?
Mm-hmm.
So
It's on the trapezius.
I think it's levator actually, but it's in that area. Okay, so I'm right up against the bone here. So what I'm going to do is use my thumb, pressing that area against the bone. So I need to be angled here, okay? I'm going to use reinforced thumb, but I'm going to check with him about how tender that is. So I'm just going to increase the pressure. You just tell me, Callum, how's that feel?
So about 3 or 4.
3 or 4? Let's just go a little bit more. How's that feel?
4, 5.
Okay, good. Let's stay with that, shall we? Stay with 5. And just breathe with that and just let me know if anything changes.
Yeah, it's going down.
Okay. And I can feel it change. What do you think I might feel change? What do you think it feels like when you're working on something
Tightness?
like that?
Is it reducing how tight it is?
Yeah, so
So
there's a give, there's a sense of give. There's often also, you know, if you have the image of what we've said about what you're doing when you compress the tissues, it does feel like that. It feels like it just disperses. It just gives way and disperses and allows, it's like a flow again. Yeah?
What about temperature?
Temperature? Sometimes when I've been using compression, I'll feel the heat afterwards more than during. If I felt a lot of heat there in the first place, can you see what effect that's had? If I felt a lot of heat there in the first place, do you think I'd do this? No. Why do you think I might not do it if I felt heat there in the first place?
Because it might be inflamed.
Yeah, so heat is an indication that there might be an inflammation there. I'm not going to mess about in an area that's inflamed. Or if it was really sharp, painful, I wouldn't do it then either. This kind of discomfort that people feel, it's a bit like when you stretch when a muscle is tight. It's uncomfortable, but it's actually not beyond, it's not a sharp pain. Yes? So that's one area. Also, we talked before, here's where I can show you. I think I might get a little flick over that. Can you see that? Can you see that flick? Okay. So there's an area of tissue, and I've got it there. That's likely to be the trapezius because it feels quite superficial. Can you see how I'm following that there? Okay. So what I'm going to do in there is I'm going to use my fingers with a little bit of attention in there to see if there's anything else in there. So it's like mining for gold. It's like you're kind of feeling along that muscle for an area that might be a little bit more tender. So how's that there?
Yeah.
That bit there. Okay? So what I've had to do there is really feel. It's not, you can't go over it quickly and expect to feel anything. I've had to kind of just, okay, I know the whole area's tight, so where have I got to go to feel there it is in there? Yeah? Okay.
Yeah.
Or
Now
does it
that
feel
one-
like a lump?
Yeah, it just feels like a tighter area within that general. And that comes with experience. I can't help you unless you do lots of feeling to really locate those kind of tissues. Now that one, have you noticed I'm using my fingers? It just feels right. I've got that middle finger on the spot. It just feels right. Is that okay, Callum?
Yeah.
Out of 10, how are we doing?
4.
4, going down, or because I haven't really focused on it.
No, it's not really changed much.
Okay, let's just hang on to that.
You're just pushing one finger down.
I'm using one finger. Not a lot of pressure, to be honest with you. That's hardly any pressure.
Right.
So you're right on top of it. And you're
I'm
not
right
on, the
on
side.
top of it. I'm
Yeah.
right on top of that area that's really tender.
Yeah.
Going down.
Yeah.
Cool. Clever stuff, isn't it? And when you let go, you come out just as slowly as you go in. What do you think? What do you think you might need to do after something like that?
Put a better side. Both for
What do you think might be the best technique to do after you've worked quite deeply? That's much more relaxed in there, and I've hardly done anything there. Okay, what am I doing now? What's this technique? Effleurage. Effleurage, really? Why effleurage? What did we say about the effleurage stroke?
To remove.
Yeah, so it's a really useful stroke to just kind of really help the circulation in that area and the venous return, and it's just useful. What I might also do in an area, if I've worked an area and it's quite tender, I might also do quite a bit of vibration type things. Why?
Move all the muscles around.
Yeah, what do you do if something hurts? You rub it, don't you? What does it do if you rub something that hurts?
Does it take the focus away from that one area?
It kind of does. It's something I'm in a habit of doing. I'm not even sure of the science of it, but I feel that sometimes what I'm doing after a compression is helping the body to integrate that. So helping to spread the load, to take the attention away from that sore spot, just to, loosen up the general tissues. Okay, so recap. You can use thumbs either side, one on top of the other. You can use reinforced thumbs, which I would suggest you do more than anything. You can use reinforced fingers, which again is quite useful in an area that's more tender because you're not going to use quite so much pressure, and sometimes that's more comfortable than that sometimes. I could have used a thumb there. You could also use knuckles, and you can use your forearm and elbows.
Do you touch the back with the elbow?
Elbows and forearms are a little bit more, we're going to do more of that down the line, but some of you are quite comfortable with that already, aren't you? Are some of you comfortable with that already? No, maybe not. Okay. So I'm just going to show you then, and I would say we will cover this down the line, but it's another option for you. So if I was to use my elbow, I would use it with a lot of, can see how that's moving off? That's why you need your hand there as a support, because otherwise it's not safe. Notice the wrist is really nice and relaxed. So don't be afraid of your forearm or your elbow, but there's a question of safety around how you apply pressure, because remember what I said to you about stilettos and platforms. If there's one area that's going to have a lot of potential damage if you're not careful, it's the elbow. So let's stick with the ones you know, but that's kind of what you could go to. So fingers, thumbs, reinforced thumb. You happy with that? You feel quite content with that? Same thing with if you were to feel some area in the hamstrings, same thing, exactly the same. Reinforced fingers, reinforced thumb, knuckles, pressing in, across the fibres, along the fibres. It's all the same, whichever area you're working in. It's what's comfortable with your hands working with the client. I didn't work with his breath, but I could easily have worked with his breath. Take a deep breath in and breathe out. Got it? Applying the pressure with the breath. Yeah, and in. Letting it off a bit, coming back on more. It's very hard to actually demonstrate something like that. He can feel what I'm doing, but you can't see it. Okay, right, in your pairs.